Hello, everyone. In today's lesson, we will be talking about urinary system disorders, specifically kidney stones, diabetes a little bit, hypertension a little bit, and renal failure. Ruth Werner does a really nice job of discussing. So I'm really going to go over sort of the basics of some of these, just because I'd like you to watch Ruth's video. It's very informative. So first of all, we are going to start with diabetes, actually. The two types of diabetes that can affect the kidneys are diabetes mellitus and diabetes insipidus. We have talked about diabetes mellitus. This is type 1 and type 2. Essentially, it's when you have too much sugar in the bloodstream because the pancreas isn't functioning properly to produce insulin. So what happens in the kidney, specifically in diabetes mellitus, is that the kidney is supposed to be absorbing all of the glucose that makes its way out of the bloodstream and into the kidney to be filtered by the nephron. But since you already have so much glucose in the blood, the kidneys can't filter all of it out. So some of that blood, or some of the glucose makes it into the urine, which is why they test for glucose in the urine as a sign of diabetes. But the problem with that is that when there is glucose in that solute, what's eventually going to go into the collecting duct, right? If there's glucose in there, a whole lot of water can't be reabsorbed. So glucose seems to prevent water from being fully reabsorbed in the kidney when it's present, and therefore you pass large volumes of urine. Passing large volumes of urine is called polyuria. So this would be more like 3 liters of urine a day versus the average of 1 to 2 liters a day for normal healthy kidneys. So polyuria is the passage of large volumes of urine. And this is a factor of diabetes mellitus, and it's also one of the first symptoms. When you urinate a lot, it also makes you thirsty a lot. So drinking a lot of water, feeling thirsty all the time is one of the symptoms of diabetes mellitus. It's actually one of the very first symptoms. So that's how diabetes mellitus affects the kidneys. The excess glucose does not allow the absorption of large amounts of water by the kidney. I'm not entirely sure how this works, how glucose in the nephron specifically prevents water from being absorbed. It seems that the water follows the glucose molecule somehow. However, that's what's occurring. So you're passing larger than normal volumes of urine and drinking a lot more to combat that dehydration that results. So the other type of diabetes then is diabetes insipidus. Now this we did not talk about. Diabetes insipidus is a hyposecretion of antidiuretic hormone. So the antidiuretic hormone, of course, goes against diuresis. So the ADH helps you retain fluid. Well, if you are hyposecreting ADH, as you can imagine, you are passing large volumes of urine. So this again results in polyuria, passing large volumes of urine. This is a problem with the production of ADH itself. So it really doesn't have anything to do with the pancreas or the kidneys. Essentially, it's a hormonal disorder. However, it is lumped in with diabetes because if you're passing large volumes of urine because your body's not making enough ADH, well, then you're going to be excessively thirsty, which is one of the first symptoms of diabetes. So in that way, both of those types of diabetes affect the kidney because they make you drink more fluid. So that's all I want to say really about the diabetes. Excuse me. The other disorders, specifically hypertension, Again, hypertension is a disorder that we've already discussed. So you have an understanding of how the hypertension works. And hypertension is, yes, high blood pressure, the silent killer. So if you have high blood pressure, there's two things that occur that can affect the kidneys. First of all, high blood pressure can lead to atherosclerosis, which is a hardening of the arteries, if you'll recall. It just makes them inelastic after a while because they're stretching, and then they just are like, I can't do this anymore. So the atherosclerosis can affect the kidneys as well. It can affect the blood vessels inside the kidneys. And if they harden, of course, they're not going to be able to expand and contract and help to maintain that glomerular filtration rate the way that they need to. The second thing that happens with high blood pressure and the kidneys is in the glomerulus itself. So you remember that the glomerulus is the little wormy looking ball of capillary that's surrounded by the Bowman's capsule. And it is driven by pressure. That filtration is driven by the pressure coming into the glomerulus. Well, as you can imagine, if the pressure is significantly higher than it should be, it is going to be pushing that fluid across harder and harder and harder. And of course, some of that stuff that's not supposed to be filtered across that membrane is going to get filtered across and pushed across. Because remember, this is epithelial tissue. This is really thin tissue in there, one cell thick, essentially. Now, ultimately, what's going to happen if the blood pressure is left unchecked or if it is continually rather high, and we're talking on the higher ends of the blood pressure scale, not just a little elevated here and there. We're talking about chronically elevated blood pressure. So what's going to happen to the glomerulus is that essentially it's going to rupture. That little wiggly sac of blood vessel is going to just burst. Little glomeruli bursting everywhere. And of course, that nephron then will not function. It's okay. Do you remember I said a nephron here or there, you have millions of them. So one or two nephrons not working anymore would be okay. However, chronically high blood pressure leads to chronic kidney disease because a lot of those glomeruli then explode. I know I'm being dramatic, but I can imagine. They stop functioning. You know, the glomerulus basically does rupture. And then you end up with, one, blood in your urine, and two, kidneys that are starting the declining process of renal failure, because if nephron after nephron after nephron stops functioning, well then ultimately the kidney itself will stop functioning. So in that way, high blood pressure does lead to chronic renal failure after a while. If the blood pressure is brought down, is kept in check with medicine, if it is under control, well, then it's not something that you really need to worry about because the blood pressure is not high enough to rupture glomerulus, essentially. Okay? So diabetes and high blood pressure can both contribute to different things within the body, but ultimately they are themselves disorders, but they lead to kidney disorders. So that's why I was talking about them in this context. Now, I would like to talk about kidney stones. So kidney stones are rather common, and kidney stones occur more in males than in females, and they occur more in middle-age males, roughly 20 to 50 years old, although they can occur later than that as well. And they are made up of the solute, but solid particles of the solute that the nephron is filtering. So I'm going to share my screen so we can see some of these. Okay, it's going to go to the Zoom meeting, but I really want to share this page first. Here we go. So these are the types of kidney stones that we have: agony, pain, and misery. Obviously, they're not really called these, but if you have ever had a kidney stone, you know how painful this really is. So these stones are made up of different types of solute, as I said. So let me show you the real picture. Here we are. Okay, so the common types of kidney stones, there are basically 4 different types. There's the, I'm pointing, you can't see me pointing. Jeez, pointing to my screen. Okay, the calcium-based stones are on the left here. These are the most common. So these are made of primarily calcium. They account for about 75% of all kidney stones. You can have one in your lifetime, or you can have multiple kidney stones in your lifetime. Although technically when you have one, you are way more likely to have another, but who knows when. So the calcium-based stones are the most common. Next, you have these struvite stones. The struvite stones are made of ammonia and magnesium mostly. The struvite stones themselves are usually pretty small, but there's a huge but in there. Struvite stones make up a bulk of what are known as staghorn calculi. Staghorn stones are pretty much what they sound like. They are shaped like the horns of a stag, and they fill almost the entire space of the kidney when left unchecked. I do have a picture of this that I'm going to show you. I'm going to hold it up in front of the camera. Hopefully you can see it. That is a rather large staghorn calculus that had to be surgically removed. Actually, the whole kidney had to be surgically removed because it fills all of the calces in there. Remember, you had the major calyx and the minor calces. Well, because it fills them, that's what looks like the horns of a stag, and that's why it's called a staghorn calculus. So the struvite stones can be pretty severe. Now, you also have uric acid stones. That's these down here. These tend to be pretty spiky. Uric acid stones are pretty much what they sound like. They're made up of a lot of uric acid. Now, people who have uric acid stones typically have high levels of uric acid in their blood. This is a symptom of gout. So a lot of times people who have high uric acid in their blood also have gout. The two are related. Now, gout is related to diet in that typically people who have gout are eating foods that are high in purines, but sometimes it's genetic. You just have a higher level of uric acid in your blood. So those are the uric acid stones. They're not as common. And then the cystine stones. Cystine stones are not common at all. They are pretty rare, and they can signal some other types of disorders if you're forming cystine stones. I'm not going into any of that. Now, if you have stones, kidney stones, their technical term is renal calculi, or renal calculus, which is singular, or nephrolithiasis. Say it with me, nephrolithiasis. Yes. So the treatment for kidney stones is called lithotripsy. So now that makes sense. Lithotripsy uses sound waves mostly to try to break the stones up where they are. So little sound waves go in and they try to dissolve the little stones if they're blocking things up. So I'm going to go back to pain and agony here because I really wanted you to see where these stones get stuck. Most of the time, these stones are really teeny tiny and they pass without you knowing, except for when you hear a clink in the toilet against the porcelain. Then you know you've passed a stone if you didn't feel it, because they are much denser, of course, than the urine, and they actually do make a sound when they hit the porcelain. Little FYI. If they don't pass without you knowing, they will pass with you knowing, and they will be exceedingly painful, because what's going to happen is any one of these, agony, pain, or misery, is going to slide down into the ureter. And remember, the ureter is really, really narrow. So these tend to get stuck in places or grind down the side of the ureter, and it's excruciating. Sometimes it is so painful that you throw up. It's a sympathetic nervous system response where you vomit because of the pain. So in those cases, you can pass them on your own, though it will take some time. Or if one is really stuck, again, you can have the lithotripsy. And there's different kinds of lithotripsy depending on the different kind of stone that you have. It's just different frequencies of sound waves. Some are really intense, like they actually leave bruises on the tissue where the sound wave was because it was that intense. If the lithotripsies are not an option, then you would have to have surgery. They will just have to go in and try to cut in there and remove the stone and sew you back up. You kind of want to avoid that because that area, well, any kind of surgery can leave you ripe for infection. So things to avoid. Now, kidney stones can be slightly diet controlled in the case of the uric acid stones, and sometimes in the case of calcium stones as well. I'm going to stop sharing for a second. Calcium stones can form due to excessive calcium ingestion. For example, if you're taking too many antacids like Tums, that's calcium carbonate. And if you didn't know that, there's a thing you know. Yeah, Tums are usually calcium carbonate made from oyster shell calcium. And if you're taking them regularly, then you could be getting too much calcium in your system. And you could be setting yourself up for calcium kidney stones. So some of it's diet controlled, some of it's genetic, some of it is just gender specific. So anyway, that's really it for renal calculi or kidney stones. Clearly nobody is going to come for a massage when they're passing a kidney stone. But at least you have an idea of what they have been through or what they're going through when they do. Okay? Now, the last thing that we are going to talk about just very briefly is renal failure. So renal failure, of course, is a process. It is not a destination necessarily. And there are two types. There's acute renal failure and chronic renal failure. Acute renal failure, as you can imagine, it comes on suddenly. It is usually due to some other process in the body. In other words, something else is happening that's causing the kidneys to shut down. The kidneys don't just usually spontaneously shut down, although they can in the case of circulatory shock. So that's one of the very few times that the kidneys will just shut down on their own. Circulatory shock can occur for a number of reasons. I'm not going to go into that. But basically what happens is your kidneys slow way, way down and they're filtering. Everything kind of contracts. And that's really to keep the blood at the core of the body. So around the heart and the lungs and things like that. That's what circulatory shock is. And when the kidneys slow down that much, this is called oliguria. Remember we had polyuria. Polyuria was excessive. Oliguria is the opposite. That's when you are only producing maybe 400 milliliters of urine a day, so way, way shut down. Otherwise, the kidneys, like I said, don't shut down on their own. So something else usually is going on that's causing that acute renal failure, which means that most renal failure is chronic, and it is a continuum. So you can be in the early stages of renal failure, or you can be in the latter stages of renal failure. your clients are going to be somewhere on that line. If you are in the early stages, then you just monitor it. If you are in some of the later stages of renal failure, you will most likely be on dialysis. And at first, you'll be on dialysis maybe once a week or once every couple of weeks. And in the end stages, you'll be on dialysis like it's your job. You'll be there every day, 8 hours a day. A dialysis machine is an external kidney. It filters your blood for you. And typically, if you are going to dialysis, it will be in the radial artery. They'll place a needle in the radial artery, and your blood will go out of your body through the dialysis machine where it will be filtered, and then it will come back in. So there will be another needle that goes back into the arm, or sometimes it's in the neck, where the cleaned blood will then be returned to your body. So it really is amazing. The dialysis machine is a miracle of modern medicine because it will filter your blood for you. And then the waste product you can actually see building up in the dialysis bags underneath, and it just looks like urine, which it is essentially, but it's outside of your body. So there's two different kinds of dialysis. There's the renal dialysis, which is what I'm talking about with the dialysis machines. And then there's something called peritoneal dialysis, where they actually use your own peritoneal membrane as a semi-permeable membrane. That one is less common. It is in your book. They go over it briefly. Either way, if a client is on dialysis, they're going to have marks from where the needles are inserted. They're going to probably bruise easily. They are going to be probably weaker. And they may need some positional adjustments on your table. Ruth Werner speaks more on this when she talks about renal failure. So I am going to let her take it from here. When we come back, we are going to very briefly talk about the effects of massage on the urinary system. See you soon.